So here we are at episode 50. In some ways, it feels like episode 104 because before I started Shaping Fire, I recorded 54 weekly episodes for my friends over at Ganjpreneur.com. But this episode is number 50 of Shaping Fire. The Shaping Fire show is in its third year, and some folks ask me why there are only 50 episodes, which works out to about 2 or so a month. The long and the short of it is that to make a quality show, I can't just spit them out. For most of my guests, I need to read their research or their book or bone up on some aspect of cannabis just so I can ask the questions that you most want to hear answered. If I just asked generic questions, the show wouldn't be particularly interesting. And the number one piece of feedback that I get from folks is that they love my lines of questioning. So I make sure I take my time when preparing a show. Also, as an interesting side note, I went to college on a full debate scholarship, so that's probably where the question and answer skills come from. Also, not only do I like to take some time building a show, but I'm out in the field constantly learning more and meeting new experts to bring them to you on the show. I'm down in California a few times a year hearing what farmers are saying and trying to get introductions to hard people to reach, like Caleb Inspecta, who was recently on the show. That interview took almost a year to bring together, but it was hella worth it. I also run my own test garden and spend the bulk of my time working with cannabis patients and caregivers, teaching them how to use cannabis medicine and set up patient grows. It doesn't pay anything, but it's the most important part of all this to me. And while the podcast can now support my basic needs through advertising, I am still doing some brand strategy and business consulting for select clients so I can afford the occasional vacation, you know? I think because I am involved in so many aspects of cannabis and am not cloistered at home in the studio, that it offers you a perspective that you won't find anywhere else. But that also means this will probably never be a weekly show, but we'll see. And while I can finally live off the commercials on the show, you'll notice that I still don't have any bottled salt and nutrient companies as advertisers. While most of the industry is propped up by helping sell salts, there's no way I would take that kind of money while being such a proponent of regenerative agriculture, polyculture, and organic cannabis farming techniques. I'm doing my best to walk my talk. Similarly, you may have realized that I'm doing fewer shows on cannabis business now and more about cannabis health and technique. Sure, there are still shows about the industry because I'm still interested in that and I'm still very much a part of that, but you aren't going to find me doing a show about like track and trace software. The content I am producing now is much more for hardcore cannabis enthusiasts than it is necessarily for business owners, though I love business owners too. It's just that I'm more interested in the plant and the medicine than I am about spreadsheets and regulatory changes. So as you'd expect, Shaping Fire evolves like it would over 3 years of the show. Thanks for listening to the show and watching the videos on the YouTube channel. Thanks for sending your kind messages and following on Instagram. And thanks for recommending me to your friends and to good-hearted cannabis businesses that you think might be good advertisers. Like our tagline says, we try and produce meaningful cannabis content worth your valuable time to check out. So thank you for being an important part of the Shaping Fire family. If you want to learn about cannabis health, business, and technique efficiently and with good cheer, I encourage you to subscribe to our newsletter. We'll send you new podcast episodes as they come out, delivered right to your inbox, along with commentary on a couple of the most important news items from the week and videos too. Don't rely on social media to let you know when a new episode is published. Sign up for the updates to make sure you don't miss an episode. Also, we're giving away very cool prizes to folks who are signed up to receive the newsletter. This month, we're giving away prize packs of the endomycorrhizal inoculant from Dynamike. There's nothing else you need to do to win except receive that newsletter. So go to shapingfire.com to sign up for the newsletter and be entered into this month's and all future newsletter prize drawings. You are listening to Shaping Fire, and I'm your host, Shango Los. Today, my guest is veterinarian Dr. Gary Richter. I had the pleasure of hearing Dr. Richter speak at Emerald Cup a while back and have been excited to have him on the show ever since. Gary is a holistic veterinarian and scientist with a practice in Oakland, California. While Gary cannot legally use cannabis in his practice, being in California means that he had to research cannabinopathic medicine anyway just to answer the questions of pet owners. He has become a national expert and is a sought-after speaker, and he's also a really nice guy. Today, we're going to talk about, in detail, the use of cannabis with pets and livestock. Welcome to the show, Gary.
Thank you. Great to be here.
So glad you could join us. So let's start at the very basic because, we talk about cannabis medicine on the show all the time. And one of the key aspects of cannabis medicine, of course, is that it interacts with the human endocannabinoid system. And often when we talk about cannabis and pets, people are often surprised that, oh, an animal has an endocannabinoid system too. And I generally explain to them that all mammals do to varying degrees. And people are surprised about that. When you talk to people about the endocannabinoid system and their pet, kind of explaining to them how it works for the pet instead of the human, how do you go ahead and explain that to folks?
Yeah, that's a really good question. I mean, explaining the endocannabinoid system can get tricky even when you're trying to explain it to medical professionals because remember, very very few medical professionals, be they physicians or veterinarians, learned anything about the endocannabinoid system in medical school either. But the way I approach it is the endocannabinoid system. It is a system of neurotransmitters that are present throughout the body, both in the central nervous system as well as in the rest of the body. And while we could talk for days about all of the various actions and physiologic responses that are caused by the endocannabinoid system, the overarching message is that the endocannabinoid system is designed to promote what is called homeostasis, which means balance within the body. So whether there's some sort of physiologic stress, an illness, an injury, emotional stress, the endocannabinoid system can help balance all of that out and keep the body on an even keel.
That's fantastic, and I think it's interesting too, the idea that the endocannabinoid system is constantly bringing any system that is running hot or running cold back to the center. And I think that's interesting because people say, how can cannabis potentially help so many different things? And I tell folks it only really helps one thing. It helps your endocannabinoid system. It's just that that happens to have its fingers in everything.
Sure.
Yeah.
I mean, it's almost like it's almost like when people talk about stem cell therapy and stem cell therapy being able to treat this incredibly wide range of medical conditions. It's because stem cells are really at the root of what cells can be in the body, and therefore they can address so many different body systems. And while endocannabinoids are clearly not stem cells, it is similar in the sense that the endocannabinoid system touches almost every system within the body, and therefore there is the potential to utilize the endocannabinoid system and phytocannabinoids to positively affect those systems.
I think that in many cases, pet owners are pretty darn sophisticated, and with access to the internet, a lot of folks are doing their research before they even go to the doctor's office. I was curious, when people come to your office, and I know that you don't recommend cannabis in your practice because of the laws in California, but people constantly come to you asking about it, which kind of forces the question, to be answered. And do you find that people generally already know that their pet has got an endocannabinoid system, or is that very advanced for just about everybody you talk to coming in?
You know what? I think a lot of people that come in, while they may have seen the term endocannabinoid system somewhere, either on the internet or wherever, they don't really have a firm grasp on exactly what that means or how it applies. But what they do know is that there is the potential for cannabis as medicine to help their pet. And while many of them may not be concerned with the specifics and the science of the why, they certainly are concerned with what can I do to help my animal.
Yeah. Sometimes people will come to me and they'll be talking about pets and they'll say, I understand there's this thing called endocannabinoid deficiency. And, they've often read Dr. Ethan Russo's papers about endocannabinoid deficiency in humans. Sure. And they're all like, how do I tell if my animal has got endocannabinoid deficiency? And I usually tell them, there's not even tests for that in humans. What do you tell them?
Well, that's pretty much the long and the short of it. I mean, even for people, Ethan Russo's paper on endocannabinoid system deficiencies, which is a fantastic paper, a lot of it is speculative, because we're we're really at the very, very early stages of understanding the more subtle nuances of how the endocannabinoid system works. And there's certainly no diagnostic testing on the veterinary side to be able to measure endocannabinoid tone, if you will.
And that actually kind of feeds into kind of a general theme today that we're probably going to run into a bunch of times, which is these studies haven't been done yet. And so a lot of the insight that you're going to be offering is based on kind of a combination of anecdotal evidence, your intuition, stories that you've heard come back to you, and your very experienced hunches. And I know that you've said that you'll point those out when they're more hunches than anything. But I think it's important for people to realize real clearly up front that these studies generally have not been done, but people are asking so many of these questions that we decided to go ahead and do an episode about it, kind of like the state of the art, like the best we know so far.
Yeah, and that's true. But one other thing to mention is there's certainly a lot more clinical data out there regarding cannabis as it affects humans from a medical perspective. And while clearly a person is not a dog nor a cat, they are all complex mammals and they all have an endocannabinoid system. So while we may not be able to necessarily, draw direct correlations from one to the next, there's enough similarities here to where if we have reasonable scientific data on the human side, there is an expectation that we would see similar effects on the veterinary side.
Awesome. Yeah, that's a really good clarification. There are a lot of very reasonable similarities and jumps that we can make, and we'll probably be doing some of that today. So, all right. So now that people generally have an idea of what we're trying to interact with in the animals that we're going to be talking about today, I have taken the kinds of animals and topics that people ask me about most often, and let's go through them over the next hour or so and talk about each, so that whoever's listening, their particular animal with that particular issue will hopefully come up. And by far, most everybody is talking to me about their cats and dogs, and I'm figuring that's probably the same for you. And the number one question I get is, my domestic pet is getting old and their joints or arthritis, or they're just not, they don't have the same get up and go because it hurts for them to get up and go. And people are asking me, all right, so they often come to me for the CBD, and then we often talk about we talk about THC instead for the anti-inflammatory. So when people are talking to you about simple joint pain for a house pet, what kind of guidance do you give them, or what kind of perspective do you set them up with?
Well, as it pertains to cannabis, that happens to be one of the areas where we do have a little bit of scientific data on the veterinary side. There was a study that was published last year out of Cornell that looked at using CBD to treat arthritis pain in dogs. And what they found is that CBD was in fact effective at controlling arthritis pain in dogs. So that is, as I say, it's one of the few areas where we actually have some real data. Perhaps the bigger question, or at least the other question is, okay, well, if CBD is effective, what about THC? What about other cannabinoids? And that is something that we really don't know definitively yet. Although, again, going back to the human literature, we do know that THC, or a combination of THC and CBD, can be very, very beneficial to treat people with pain. And as such, it's probably reasonable to assume that similar things could be experienced by dogs and cats. Now, the trick to all of this, of course, is what product and what dose, and that's where the rubber hits the road, so to speak, as it pertains to sort of veterinary medicine or human medicine and the use of cannabis. So that's something that as I'm sure you and your listeners know, really plays a huge bearing on the effect of any any kind of cannabis preparation, the varying either amounts or ratios of cannabinoids, terpenes, what have you. And that's really where we need to be looking and where we need to be focusing.
Yeah, I often wish that I could speak to these dogs and cats. That people come to me and they say, "Oh, we've got our dog, and we gave it just a little bit of THC based tincture because it had joint pain, and we were hoping for the inflammation to go down enough that the dog can, heck, sometimes just go outside to defecate, and so people will give their animal just a little bit of THC, maybe a milligram, maybe a milligram and a half, a very, very small amount. And then the dog will, get up and kind of lumber around and seem like it's in good spirits and step out. And I'm always curious to know whether or not, is this the dog experiencing muscle relaxation and less tension of the muscles and less inflammation somehow in the moment? Or is it just that the dog somehow is experiencing a pleasant cannabis experience like so many of us have, which kind of changed their mood and caused them to get up? Because we try to anthropomorphize their actions, and it's so important what the motivation of the actions are when we're talking about dosing humans. And the doses are so much more sensitive and lower for an animal. It makes it very challenging to come up since there's no studies yet.
Yeah, I mean, it is very challenging, but one thing that we do know with dogs in particular is that dogs actually have a greater number and a greater concentration of CB1 receptors in their brainstem than do people. And as such, they are much more sensitive to the potential toxic effects of THC than would be a human on a per weight basis. So what that means is that we do have to be very, very cautious with the amount of THC a dog gets. Now, you mentioned like a half a milligram or 1 milligram of THC. Now, it kind of depends on the size of the dog. For example, for a medium to a large size dog, probably a milligram of THC is not going to have any outward effects in a negative sense, like the dog's not going to be high, the dog's not going to be experiencing THC toxicity. But that said, it's possible that even at that low dose, that amount of THC could be providing some pain relief, could be providing some relaxation. As you say, I mean, it's very difficult to get any kind of direct feedback from a veterinary patient. So all we really have to go on is how they're acting, how they're moving around. Because, from the dog's perspective, there is no placebo effect here. Now, certainly, as a human perceptual issue, we may read things into it that aren't there, and that is a placebo effect in and of itself. But if the dog is unquestionably doing things that it otherwise wasn't doing, the only explanation for that is because they feel better.
Yeah, that makes sense. And also, kind of to relate that to the humans, and we talk about this often on the show, where people are experiencing or they're looking for relief from something, but they really don't want to experience any level of THC euphoria or intoxication. And so we always tell people to take 2.5 milligrams 4 times a day, and you may never feel it, but it's still at those clinical doses still causing muscle relaxation and causing anti-inflammation. It's just not a high enough dose that you're getting anything in your head. And I think that's exactly what you're describing for the veterinary patients as well.
Yeah, that's very true. As when I speak to groups of pet owners or groups of veterinarians, I mean, I very frequently tell them that it is just like with a person. It is absolutely possible to put an animal on THC and have them not be high. It's just a function of understanding how many milligrams you're giving relative to the body weight and or species of the particular animal that you're treating. And to go along with that, therapeutic dosing, so doses of, say, THC that have a positive effect, medically speaking, do not have to be psychoactive doses. There's plenty of space in the therapeutic dosing window that are well below whatever would cause psychoactivity in a human or an animal, and you can still get benefit from it. I mean, look at all these people that are out there that are functioning members of society that rely on cannabis, to get through their day, because they have pain or anxiety or whatever it is that they may have. Those people are not walking around high. It's just that like with any medication, you have to understand what you're giving and what dosage you're giving.
I think it's important too to point out that while, let's see, how do I want to go into this? So I think I'm going to start with the anecdote. So over the course of my life of using cannabis, I have been in the presence of other people who have had pets, and at some point they got the pet high, by blowing smoke in their ear or whatever that I've seen happen. And at some point the pet decided that it liked it. So that when I'm over at their house and they light up, the let's say the dog hears the lighter, and so the dog comes in the room and is kind of begging for it. I always found that to be really extraordinary, both because I did not think it was fun or funny to dose an unsuspecting animal, but since it had already been done and I was there and the animal seemed to want more, I found that to be a rather interesting data point. Do you have any feedback from your patients and their owners about pets that have acquired a desire for more of it?
That's honestly, that's not something that I've really come across. I mean, I feel pretty strongly that that kind of activity, like intentionally blowing smoke in your dog's face or something, that's not okay. And in fact, that borders on animal abuse. Partially because these animals are not equipped nor aware of what's coming from a psychoactivity standpoint. And also because, inhaling smoke is not necessarily good for anybody. And it's certainly not good for dogs and cats. And if cannabis as medicine is something that they benefit from, and one could speculate, if that individual dog seems to seek it out, maybe there's something that dog is getting from it medically speaking. Mm-hmm. Maybe something hurts less, or maybe they just generally feel better. And if that's the case, then that's when it's time to investigate a more responsible use of medical cannabis rather than what I would describe as irresponsible use of recreational cannabis.
Yeah, right on. That makes sense to me. So we talked a little bit about the potentiality for the use of both CBD and THC to decrease, pain and joint pain, and just general body aches of a older domestic pet. People have started writing online that they're using CBD to rebalance the endocannabinoid system so their pets don't have allergies. And I've never run into this with an animal before, so I don't know how I would know that my pet has an allergy, what it's to, and then to choose to treat it with CBD. But what do you have in that category?
Of all of the things that I've seen animals benefit from cannabis for, allergies is not at the top of the list. As we have mentioned, cannabis in its many forms, it does have anti-inflammatory properties. It does have sort of overall immune system and body balancing properties by virtue of promoting homeostasis, as we discussed before. I have, in fact, on a couple of occasions seen topical cannabis products used on animals that seem to have helped a little bit with itching and allergies. So I think, there may be something there. Although, like I say, you look at all of the various things that cannabis is used for, in people as well. And, treating allergies is not super high on that list of things. I think there are other options out there, both natural medicine wise and, if necessary, pharmaceutically speaking, that probably would work a little better.
One thing I've seen for sure is when folks will administer small amounts of THC to their domestic animal that for pain or something, often they will get the munchies, and you can just see them go to town on their food, and people are often overjoyed because, like, oh my gosh, the animal had so much, it was in pain, and they weren't getting a lot of movement, and they didn't even want to go over to their food bowl, and now suddenly there's movement, and they just totally cleaned out the bowl. And so they kind of help bring the pet back to health by leaning on what I'm assuming is going to be the myrcene in the THC preparation. Have you seen that taking place in your practice?
You know, I'm not honestly convinced that cannabis is directly an appetite stimulant in animals, like, from like the munchie standpoint. But what I think we do see is, because a lot of the animals that are receiving these medications, they're not eating, or they're not eating well because they don't feel good. They feel sick, whether they have an upset stomach, or they're in pain, or there's something else going on. I mean, I think we all know from our own health that when you feel crappy, going out and eating a bunch is not necessarily always, your first priority. And I think what happens with these guys is oftentimes we see them eat better because they feel better. So they're not in pain anymore. Maybe their stomach upset is relieved, and therefore they're going to eat more. But like I say, I'm not 100% convinced it's directly appetite stimulating in the sense that, like, people get the munchies.
See, this is another great place that we'd love to ask them,
Yeah, right? You'd really love to.
Yeah, totally. So I ran into something new recently. Someone using a myrcene dominant THC tincture with their pet after surgery. So they had a pet that normally has a lot of energy and was going to be jumping around, and they did not want to give it traditional pharmaceuticals to dope out the animal after the surgery, but they were still concerned about the sutures getting ripped open, or just letting them have the time to get over the trauma of the surgery. And so what they did is they used this tincture, and they intentionally got their dog a little high, but the dog seemed fine and relaxed and just kind of chilled out around them for the next few days. And then they stopped the dosing, and the dog kind of perked back up and went on its merry way. And, outside of the discussion that we've already had, that you've got to be really darn careful with dosing, and we're going to talk more about dosing after the break. What do you think about, the use of a THC tincture to kind of slow down or, incapacitate an animal so that they can get through their more important healing?
It's a really interesting question because well, like, in my mind, my immediate sort of knee-jerk response was going to be, that's a bad idea. But when I look at the kinds of pharmaceuticals that we typically use in veterinary medicine for just that purpose, so post-surgical animals, to keep them calm, to keep them from being too active after a surgery. I mean, effectively, that's kind of what we're doing, is we're intentionally sedating the dog or the cat or whatever, so they're not excessively active. So, is giving, say, like a pharmaceutical like trazodone, is that demonstrably better than somebody giving an appropriate dose of a cannabis preparation with THC and myrcene? I mean, honestly, I don't actually know the answer to that question. That's one of those things that down the road, I think research would be really fascinating to start to look at, like physiologic parameters, like heart rate and respiration rate and pain response. It'd be really fascinating to see if cannabis can be appropriately used in that sense. Clearly. It is going to be extremely difficult, if not impossible, for a pet owner to get any kind of guidance in that regards from a veterinarian. So, that, as you say, that just, it rolls us back around to that discussion of dosing. And I think that's particularly important with this particular scenario, because now we're talking about really getting up close to the line between a therapeutic dose and what what would be considered a toxic dose.
Yeah. So let's pick up this dosing conversation after the first break. You are listening to Shaping Fire, and my guest today is veterinarian Dr. Gary Richter. Now that the health benefits of terpenes have become well known in the cannabis industry, people everywhere are looking for the purest terpenes and custom terpene blends. True terpenes, isolated terpenes, and terpene blends are tested to the most demanding worldwide safety and stability standards. Terpenes from True Terpenes are third-party tested, non-GMO, and food grade. They're triple distilled, making them the purest terpenes available in the world. With over 1,000 terpene isolates, strain profiles, and terp flavors, you can be sure that True Terpenes will have the perfect aromatics for your manufacturing goals. True Terpenes also offers custom blending so that you can match your company's marquee strains across all your product categories. While you can certainly simply just order terpenes and go right to manufacturing, True Terpenes also offers a wealth of manufacturing insight, best practices, and a willingness to help you break new ground with your product formulations. True Terpenes has robust and supportive customer service too, so your questions will get answered fast and efficiently. If you've shopped for terps before, you know how rare that is. If you are a cannabis product developer, these are the terps that you want to add to your oil or edible or capsule or beverage. True Terpenes are simply the best your money can buy. Don't try and make a premium product with substandard terps. Choose True Terpenes for a top shelf experience. Go to shapingfire.com/True Terpenes to find out more or click on the link in this week's newsletter.
Cannabis is fun medicine and we love to celebrate it. Cannabis connects people and creates opportunities for new friendships. At the Toke Shop, we create custom cannabis-themed jewelry, money clips, rolling trays, and home furnishings that you'll love. And they also make great gifts, too. I'm Ashley Villafranca, owner of the Toke Shop. I came to cannabis as a patient seeking an alternative to the pharmaceuticals being pushed at me for chronic pain and fibromyalgia. I realized that not only was cannabis a huge help in controlling my symptoms, but I found cannabis to be wonderfully social, too. Cannabis makes friends. So I took my love of jewelry design and blended it with my newfound passion for cannabis and began handcrafting bracelets, earrings, and friendship necklaces, and then expanded to money clips, rolling trays, and other home furnishings, all made in sterling silver, 14-karat gold, and aluminum, so there's something for everyone's budget. I consider it all to be new age cannabis fashion and cannabis couture. I invite you to stop by my website at thetokeshop.co. At thetokeshop.co, you'll find a wide array of attractive and fun cannabis items starting at only $10. And if you're fancy, there are very fine luxury pieces as well. And I'm always happy to do custom orders with your name or a particular theme. Come check out my array of items hand-stamped with terpenes, cannabinoids, and other cannabis themes. That's thetokeshop.co. Thanks!
Welcome back. You are listening to Shaping Fire. I'm your host, Shango Los, and our guest this week is veterinarian Dr. Gary Richter. So before the break, we were talking about the importance of making sure you get the dosing right. And, this is true of humans as well, because you can very easily move somebody from a dose that's going to help them to an over-medicated dose that's going to have them, potentially upset for an hour or so. And we never want to do that with animals because they don't know what's going on to them and they trust us to take care of them the best way that we can. But it's hard because most people don't know how to even dose humans properly. And so when they're trying to apply the same lack of experience to their pet, things can get into trouble real fast. So, Gary, during the first set, you were talking about how dogs have got more CB1 receptors, and so they have a faster uptake of cannabinoids. And I often explain that to people. It's like the difference between taking an edible versus hitting a joint. When you inhale a joint, it goes to your lungs and it goes immediately in your bloodstream and it hits you all at once. And that's why you feel stoned faster. Whereas when you take an edible or a capsule, it takes a longer time to be processed through your body and it comes on a little more slowly. Well, with what you educated us about earlier about the CB1 receptors in dogs, that tells me that we've got to be even more careful than I thought we needed to be. So when you're talking to people about figuring out dosing, what do you tell them when they're trying to weigh, like, how do I know how many CB receptors my pet has got versus dog weight? These are unknowns at this point. So how do you help bring somebody through it?
Yeah, I mean, I think there's a couple of hard and fast rules in this regards, and if I were, say, speaking with a group of pet owners or educating veterinarians on ways that they can think about using cannabis in their practice, the two things that I think are important to remember as it pertains to dosing is number one, it's all about body weight. It's all about the body weight of the animal. So it's interesting when you look at dosing for humans. Very commonly in the literature, you'll see this drug X number of milligrams per adult human male or human female. But there's so much variability in sizes of adult dogs. I mean, you can have a 1 pound Chihuahua or a 200-pound Great Dane. So knowing how much the patient weighs is got to be step one. And step two, as we often say, even when it comes to human medicine, it is very much a start low and go slow kind of approach.
Yeah.
So, we start them at a dose that we know is going to be safe and is very unlikely to cause any sorts of side effects. And then slowly over time, we increase that dose until we either get to a therapeutic effect that we're looking for, or we've gone so high that we're now seeing side effects that we don't like, in which case we may need to think about a different medication.
And that's why it's important to go slow, because that, if you're going to go step, 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 and like, let's say that it's the fourth step where you're starting to see adverse reaction, you don't want to be taking big steps so that there's a big adverse reaction. You want it to be very, very subtle so that you can read your animal's body language and then realize, okay, this is our threshold point here. And so again, it's important. What would you call a small step? Are you talking about increases of like a 0.5 milligram?
Well, again, I mean, it's hard to say on a per milligram basis because it depends on the size of the animal. So, I might look a little bit more from a percentage increase rather than per milligram. So probably, a safe thing to start with would maybe like a 20% increase on a weekly basis. And what people need to kind of look out for is if as they're ramping that dose up, if they give an increased dose and the pet looks, they look a little glassy eyed, they look a little out of it, they're sort of staring off into space, then probably that means we need to back off the dose somewhat.
So Gary, one of the things that everybody wants to know is the exact dosage that they need to start with, and this is difficult, right? Because nobody wants to talk about it, and when I read places, they don't want to go to that level of detail. So you've already spoken real clearly that there are variations between a smaller pet and a larger pet, but there's got to be some algorithm where we can get people to start because they're going to do it anyway. So what do you recommend?
Yeah, I mean that is true, and that is invariably one of the questions that almost all people who are looking at cannabis for animals have, and quite rightly so. So to start with, as it pertains to dosing, to start with CBD, and I'll start with that because we actually do have some research information here. The study that I was mentioning a little bit earlier that came out of Cornell looking at dogs with arthritis, as well as another study that came out of Colorado State University looking at dogs with epilepsy, so treating seizures with CBD. Both of those studies looked at dosages approximately of 2 milligrams of CBD per kilogram of body weight twice daily. So, as a doctor, we sort of think in terms of milligrams per kilogram when it comes to dosing. But what that really translates to in plain English is about 1 milligram of CBD per pound of body weight. So, for example, if you have a 10-pound dog, you're talking about, give or take, about 10 milligrams of CBD twice a day. Now, mind you, if you're familiar at all with CBD dosing, that dose may strike you as high. And in truth, when I saw these studies initially, I kind of found that dose seemingly a little on the high side as well. I have seen a lot of animals do very well on much lower dosages of CBD. So it may be that even significantly lower dosages can be beneficial, but as the margin of safety for CBD is like a mile wide.
Yeah.
So you don't have a lot of concern there from the standpoint of overdose toxicity, that sort of thing. Now, clearly, that's not the case when it comes to THC. So let me preface this by saying that the dosing that I'm about to discuss is unfortunately not based on any scientific research at this point. It's really a combination of extrapolation from human research, what I have seen work well in pets, reports that I've gotten from other veterinarians, from other medical professionals, etc. But I think it's a reasonably good guideline, and the guideline from the standpoint of starting a THC dose for a dog or a cat is going to be approximately 0.05 milligrams per kilogram twice a day. So that's 0.05 milligrams per kilogram of body weight twice a day. So again, in plain English, what that's going to translate to is about 1/4 of a milligram per 10 pounds of body weight. So if you have, for example, a 40-pound dog, you might think about starting with 1 milligram of THC twice a day. And as we discussed, you can sort of slowly ramp up from there, but that should be a reasonably safe place to start.
So, Gary, of course, that brings us to how do we actually get the dose into the animal? Often I will recommend to pet owners to use an alcohol-based tincture because that goes through the skin so easily. And following the analytics on the label to dose them the proper amount on the skin, under the fur, on the back of the neck. And I've heard some people do that same technique, but they'll do it with the ear because it's got, very soft membranes as well. But in your role, you are constantly teaching people how to give their pets, capsules or liquids or whatever they normally need to take. So how do you advise people to actually get the cannabinoids into the animal, who won't necessarily recognize it as food?
Sure. So, I'm a big proponent of cannabis infused oils, and I like them for a couple of reasons. The first reason is whenever you're administering a liquid, you have a lot of leeway as far as dosing goes. So, as we were discussing earlier, if we're going to go with these sort of start low and go slow theory, and we're going to say, okay, well, increase by say 20% each week. If you're going to do that with a liquid, it's quite easy. If you're going to do it with something that looks like a food item, like a dog biscuit or something, 20% can be tricky. It's hard to break those things up into sort of even portions. And I also do like to give the oils directly orally with the intent that hopefully we're going to get a certain amount of transmucosal absorption. So absorption into the bloodstream directly through the mouth, even prior to that medication being swallowed and ultimately digested and absorbed through the gastrointestinal tract. So, I think oral administration is certainly my preferred method. Just to address what you were speaking about before, what I would call transdermal, so putting it on the skin with the intent of being systemically absorbed. We don't have an enormous amount of information about the efficacy of that. But I can tell you that the aforementioned study from Colorado State University looking at epileptic dogs also looked at rates of absorption of various methods of administration of CBD, and they found that the transdermal absorption was the most poorly absorbed preparation.
Oh, interesting.
So at least preliminarily, it may be that cannabis is not super well absorbed in that way. But if nothing else, one thing that I can say really just from my experience with other transdermal medications that are used in veterinary medicine is at best absorption is unpredictable from one individual to the next. So it's a little bit hard to tell how much is actually getting in the patient.
Yeah, fair enough. So if you are recommending oral, and if I understand your vocabulary correctly, you don't really want it, clearly we don't want to do like a preset dosed biscuit, dog biscuit or something, or animal, whatever. But we do want to use an oil. But you're also saying don't take a pre-measured amount of that oil and apply it to the dog biscuit you regularly give them. I think you're saying just put the oil in their mouth. Is that what you're saying?
I mean, I think in a perfect world, yes, that's what I'm saying. Now, I mean, that's all well and good, but I mean, if an animal is just bottom line not amenable to being medicated that way, then by all means feed it to them. Put it on food. Put it on a treat. It's not. These things are not, it's not black or white. I think if we're looking for the most efficient means of absorption, directly orally is probably a good way to go. And I think that speaks a little bit to the conversation of if you get the right preparation for the individual, dosing becomes really easy. Because let's say that if I'm going to dose some given dog, and based on the concentration of the medicine that I have, the dose is 2 or 3 drops of oil, I can put those drops of oil on my finger and just lift up a lip, rub it on his gums, and I'm done.
I see.
So, right. If you get a wrong preparation and you have to give like 3 teaspoons of oil, then yeah, that's going to be a problem.
Right on. And it's always important, I think, when just like interacting with human patients, when you have an animal patient, they have got a life experience too. And we want to make sure that we create a healthy experience for them so they don't want to resist being handled and medicated. And who knows, you might have an experience like we talked about earlier where the animal realizes that after I get rubbed with this oil on my gums, my pain decreases. They may end up being like all in, like I'm in favor of this.
That may in fact be true. The one part where it may not work out as well as we want it to is while dogs and cats are certainly very attuned to a cause and effect relationship, it may be that the effect is far enough down the road from the cause that they don't connect the two. If they don't feel better for like a half hour, they may not connect that to when we put it in their mouth.
Yeah, fair enough. So let's take this to the far end of the scale, right? Because at the far end of the scale, we've got animals with cancer. And for folks who do not understand what a typical human cancer protocol is, it's taking 60 grams or technically milliliters of this cannabis oil, commonly known as Rick Simpson oil or ethanol hash oil. But essentially, it's an ethanol extraction of the oil from the plant, very concentrated. And a human will take 60 milliliters of this over 90 days. And that is an extraordinary amount of cannabinoids. And just about all the patients find that they sleep through the majority of the time because it's so it makes you so lethargic. There are certainly people who will be taking these high dosage and it actually is a buoy to them. They're actually feeling better and more lighthearted and they don't sleep. But that's really uncommon. Normally people are lethargic and they sleep most of the time. But the problem is that when people are getting up, when they're titrating up and going to a higher dose every third or fourth day, sometimes you get nausea from the higher dose or like any kind of dysphoria that people will sometimes have when they take too much THC. And so people will say, okay, I know that that humans are taking a THC preparation for cancer, and my dog has got a tumor or some other form of cancer, and so I want to do that for my dog too because they have an endocannabinoid system. And so the problem, though, is that when you're working with a patient, the patient is giving you very clear feedback about how they're feeling, and we are dealing with high dosage, so that feedback is incredibly important. When we're doing this with our house pet, we are way closer to cannabinoid toxicity levels by trying to do a high enough dose that is actually acting as a cancer cure, because this is way more of a dose than just helping them with joint pain. But the animal can't give us really quality feedback to know if they are getting paranoid or getting upset or getting nauseous or any of these things. And it makes for a very difficult situation. And yet I'm regularly hearing from people who are buying syringes of ethanol hash oil, putting it in capsules and giving it to their animal to try to help with their tumors. I think that there are so many ways for this to go wrong. What has been your experience?
Well, that is an accurate statement. There are so many ways for this to go badly. First of all, if anybody has ever had the experience of eating too many edibles, you can start to get an idea of what kind of effects that we're talking about. I mean, overindulging on edibles is not a good time for anybody. And if you've ever seen a person on one of these cannabis protocols for cancer, I will tell you that it is brutal.
Yeah.
It is not fun for these people. But you know what? I mean, if it's something that as a human, if that's what you've signed up for, then you've made that decision and you understand why you feel the way that you do, and that's all great. That said, we cannot do that. We can't do that with animals. There's a couple of things to say, I guess, in that regards. First of all, just from an oncology perspective, so from a cancer treatment perspective, there's a little bit of a different philosophy when it comes to animals versus people. So, for example, if a person has cancer and they go to their oncologist, essentially their oncologist's mission is to keep their patient alive no matter what. And sometimes that means damn near poisoning them to death in the process. When it comes to veterinary patients, when it comes to animals, nobody wants to put an animal through that kind of chemotherapy. And as such, the goals of oncology when it comes to animals is not to preserve life at all costs. It is to preserve quality of life. So I think that's the first thing that we have to really sort of pay very close attention to is it's cancer, and just like with people, a lot of pets unfortunately are going to ultimately succumb to cancer. And the best thing that we can do for these animals is to give them good quality of life for as long as we possibly can. So having them uncomfortably stoned out of their minds for the last weeks or months of their life is really not a good way to go. To speak to the specific preparations, I know there's a lot of people out there that are buying Rick Simpson oil and other sorts of super concentrated cannabis oils. I would highly, highly advise against giving any of those products to animals. And the reason why I say that is because those products are so concentrated that it is functionally impossible to accurately dose. So we talked a little bit earlier about dosing, on a milligram per kilogram of body weight basis or a milligram per pound of body weight basis. When you're talking about something like Rick Simpson oil that is so concentrated that a grain of rice size 10, 20, 50 milligrams of THC, and let's say your dog's dose is 1 milligram of THC, there's no way you're going to be able to sort of accurately dose that. Again, from a doctor's perspective, a grain of rice is not a dose.
Yeah.
My immediate thought is always like, what kind of rice? Is it long grain? Is it short grain? Is it basmati rice? I mean, you can't dose medicine in this way. I mean, if you're going to call cannabis powerful medicine, which it is, then we need to treat it in the same way that we would any other powerful and effective medicine. So to kind of just sort of bring this in for a landing, I guess, as it pertains to dosing cannabis for cancer, oftentimes the goal with these animals is to ramp them up to the highest dose that we can get them on and have them still feel okay and feel functional. Remember that just like with people, dogs will develop a tolerance to the psychoactivity of THC over time. So over time, you can get them on much, much higher doses of THC than you will be able to give them on day one. And I will tell you that I have seen dogs with cancer on doses of THC that if I were to take it, I would be under the covers for 3 days. So, they can develop a tolerance just like people can, but you got to do it slowly, and you really just don't want to push it any further than they can handle.
Right on. Thank you, Gary. This has been a great set. I'm really glad to be able to get this level of specificity on dosing all together and in one place. So it's time for us to take our second short break and be right back. You're listening to Shaping Fire, and my guest today is veterinarian Dr. Gary Richter. Did you know that Shaping Fire has a fabulous YouTube channel with content not found on the podcast? When I attend conventions or speak or moderate panels, I always record them and bring the content home for you to watch. The Shango Los YouTube channel has world-class speakers, including Kevin Jodry of Wonderland Nursery, talking about breeding cannabis for the best terpene profile, Nicholas Mahmood on regenerative and polyculture cannabis growing, Dr. Sunil Agrawal on the history of cannabis medicine around the world, Ben Cassidy of True Terpenes on using terpenes for health in your everyday life, Reggie Gaudino of Steep Hill on the cannabis genome, and Jeff Lowenfels on the soil food web. There are several presentations from Dr. Ethan Russo on terpenes and the endocannabinoid system, and even my own presentation on how to approach finding your dream job in cannabis and why we choose cannabis business even though the risks are so high. As of today, there are over 100 videos that you can check out for absolutely free. Go to youtube.com/ShangoLos or click on the link in this week's newsletter. As a listener of Shaping Fire, you already understand the importance of living soil when growing cannabis. When you have active microbe communities in your substrate, you go way beyond simply fertilizing with nitrogen, phosphorus, and potassium. Having active microorganisms in your substrate supports vigorous plant growth throughout the plant's root zone, making for higher yields and thriving flowers. Mammoth P is the first organically derived microbial inoculant that focuses on your plant's nutrient cycling processes to release soil phosphorus and other micronutrients from their bound forms, making them more available to the plant. Increased levels of phosphorus will also keep internodes shorter and focus your plant's energy on bud production. Not only that, but the microbes act as a defense shield for the plant's rhizosphere by outcompeting potentially harmful pathogenic microbes. Pretty cool, right? Mammoth P not only unlocks the nutrients in your soil, but it also helps protect your plant from disease. Mammoth P's beneficial bacteria act like microbioreactors, continually producing enzymes that release nutrients. Mammoth P was developed at a U.S. university and has been extensively tested by Colorado growers and independent laboratories. Mammoth P is proven to increase growth and enhance blooming. One of the great things about supplementing with microorganisms is that they won't compete with whatever fertilizer program you're already running. Simply dose on top of your fertilizer schedule for increased benefits. To learn more and to find out where you can buy Mammoth P near you, check out their website at www.mammothmicrobes.com. Partner with microorganisms to create beautiful, thriving cannabis. Mammoth P. Welcome back. You're listening to Shaping Fire. I'm your host, Shango Los, and our guest this week is veterinarian Dr. Gary Richter. So far in the show, we have talked a lot about your typical domestic pets, your dogs and your cats. But, I live rurally on an island, and a lot of you have got livestock and other types of animals too. So before we wrap up today, I think it makes sense to talk with some of those. So Gary, let's start with really small non-dog and cat animals. Clearly, because they don't have endocannabinoid systems, we take lizards and snakes and things like that out because they're not mammals. But let's talk about, for example, bunnies. Bunnies are very common, they become pets very quickly and become house rabbits. And I'm familiar with people using cannabis with their bunnies as they get older, and they want to help them bring back their hop a little bit. So what do you think about small mammals and the difficulty with dosing them at such a low amount?
Before we get to that, let me just make the point that reptiles do have endocannabinoid systems, as far as we know.
Oh, I did not know that, huh?
And in fact, the endocannabinoid system is fascinating in the sense that if you look at the types of animals that have an endocannabinoid system, evolutionarily speaking, you're going back millions and millions of years. I mean, there are marine invertebrates that have an endocannabinoid system.
Wow.
So I mean, most complex animals that you can think of have some form of an endocannabinoid system. Of course, that doesn't mean that it works exactly the same way as it would in a mammal. But from an evolutionary standpoint, it is pretty well ingrained in the animal kingdom. Now, to get to your question about small furry things like bunnies and whatnot, the reality is we don't really know pretty much anything as it pertains to dosing on these sorts of things. I can tell you that sort of the digestive tract and the metabolism, of a rabbit or some other, sort of small furry animal like that, is pretty drastically different from that of a dog or a cat. So it's probably not applicable to just sort of downsize the dosing accordingly per body weight. As a rule, a lot of these animals are significantly more sensitive to pharmaceuticals than say would be a dog or a cat on a per pound basis. So odds are the dosing is actually going to be lower than people might think. I think from a safety perspective, if somebody had like an arthritic bunny or a bunny that had like back issues or something, they could try a little CBD, I think quite safely, and see if that helps. I'm not aware of any medical issues that have come up as far as that goes. With regards to something like THC, like I say, I mean, there's just no information out there to even have a clue about where to start from a dosing perspective.
So let's go the other direction. So I live on an island that is very equestrian heavy. And there are horses everywhere, and people see THC and CBD being used in other animals, and so they're looking to deploy THC for injury, for everything we've pretty much discussed, talking about using it for dogs and cats earlier. They're starting to cross apply to horses, and people are starting to experiment with high doses of CBD to keep horses calm. But these are huge animals with a pretty significant different kind of system, right down to how they process their nutrition. What are your thoughts on using THC and CBD and the other novel cannabinoids on these larger livestock animals?
Yeah, that's a really great question. And again, I mean, there are people that are starting to look at those issues. I mean, I can tell you just, from a pharmacology standpoint, horses on a per pound basis usually take far, far less medication to be effective than, say, would a dog or a cat. So the dosing is very likely to be a lot lower than people would think that it would be. I do know that there's some people out there that are starting to look at the use of CBD in horses. Again, we don't really have any published or even very much anecdotal data out there as far as specific doses go. Certainly one thing that I would urge extreme caution with as it pertains to THC in an animal like a horse is potentially causing even mild THC toxicity in a horse. I could foresee as being a very, very concerning thing. From the standpoint of horses, as you probably are aware, are fairly fragile creatures. And if a horse would, got a little too much THC and lost their footing and fell, I mean, that literally could be a life-ending event for a horse. So, that's something I would certainly urge extreme caution. And if people, if there's horse people out there, they may actually have a little bit more information than I do because that's not really so much the world that I live in. But I would definitely urge extreme caution and taking things very, very slowly.
And not only could it potentially put the horse or other livestock at risk, but also, I mean, we all know how dangerous a horse can be when it is spooked or ornery. And if it's having this experience that it's never had before and it's feeling unsafe, wow, it could hurt the people around it, and it could hurt itself against things that are nearby.
Yeah, I agree. I mean, it's I'm not going to say that it's something that should never be done, because again, it's a little out of my area of expertise. But I mean, it's something that should be done under veterinary guidance and very, very carefully.
Right on. I think that's a good point for us to say, we're pulling so much of our experience from anecdotes and from personal experience of people doing this on the animals that tend to be most commonly in our lives, right? Dogs and cats. And as we work our way out to smaller animals like rabbits and larger animals like horses and cattle, the number of data points that we have even anecdotally get less and less and less. And so if you're working with animals at either end of the scale, don't think that you can just take the dog or cat dosing algorithm and just apply it to these other animals.
Right. Yeah, you're absolutely right.
Yeah. So let's have a little discussion about topicals for these animals, because topicals are nice because they generally keep the dosing pretty low, and certainly CBD topicals for psoriasis and dermatitis and these other types of skin issues certainly are great for animals. My question, which is pretty basic, is how do you use a topical with an animal with fur?
Well, it's tricky. It's tricky for two reasons. The fur is certainly one of them. And, if there was an area of skin that seemed like it really warrants a topical, then it may be that area needs to be shaved. Because otherwise, I mean, I think a topical would be difficult. I have seen some products out there that are essentially just alcohol extracts that are packaged as a spray. So it may be that, you might be able to, get good skin contact with a spray, even without shaving. And there are certainly endocannabinoid receptors in the skin and the hair follicles. So, I mean, I think there's absolutely medical application there. The flip side of it, the other thing that we have to be concerned about is that, anything that you put on an animal's skin is liable to get licked off. Oh, yeah. And that's a real issue, particularly if you're talking about a topical product that has THC in it. Because, again, now we have to think about, well, how many milligrams of THC is this dog ingesting? Because they're licking this stuff off. And is that a concern from a toxicity standpoint? So it may be that if people are using topicals, particularly ones that have THC in them, they're going to have to put what we call an e-collar, like the lampshade, if you will, something on them to prevent them from turning around and licking that stuff off.
So, Gary, before we move on to talking a little bit about pet nutrition, I do want to point out that there's not any quality standards that are enforced for pet medications. And there are a lot of folks that are in the green rush that are bringing cannabinoid isolate products to the market. And as we've learned with humans, it's very important to use a whole plant preparation, because these individual molecules, say, for example, CBD, which is short for cannabidiol, a lot of people put out products that are just that individual molecule in some kind of vehicle, and they suggest that it might work just like all the studies say. And yet, the vast majority of the studies are all focused on whole plant preparations, meaning you do a whole plant extraction, and you not only have the cannabidiol there, but you also have the other novel cannabinoids, the cannaflavin, and all the other parts of the cannabis plant that are found in the trichome oil there also. And they work together to do what's called the entourage effect. They work together as a complex lock that unlocks the endocannabinoid system. Well, unfortunately, there's a lot of people who are bringing products to the market that are just these individual molecule isolates. And so my question for you is, do you find that whole plant preparations are preferred for animals just like they are for humans?
It's a really good question, and that is certainly something that comes up a lot, because, as you say, I mean, there's a lot of people out there that are looking to make money in the cannabis industry, and certainly CBD isolates are certainly one of the things that are out there. I in my office I practice what I would describe as integrative medicine, meaning that I offer both conventional Western care, but also holistic and natural medicine, and we use a lot of herbal preparations in this office, both Western herbs, Chinese herbs, what have you. And as such, I am a very big fan of the entourage effect and of whole plant extracts. In my experience, I find that those products tend to work better, usually than isolated compounds. And I think that this kind of plays out a little bit if you look at, for example, if you look at reports from people who are taking medications like Marinol, which is synthetic THC. So that's basically just pure THC isolate that was manufactured synthetically. Molecularly speaking, it's the same THC that you would find in cannabis. It's just that there's nothing else there. And very frequently, those people will report that whole plant cannabis tends to work better for them than just the THC isolate. So, I mean, I think that it bears out that these isolate products, speaking in generalities, do not work as well as a really good quality full spectrum extract.
Very good. So one thing that's interesting about folks, everybody, and how they acquire endocannabinoid deficiency, we generally suggest that unless you're predisposed to it, people generally get endocannabinoid deficient from stress and anxiety and poor sleep and poor nutrition and environmental toxins and things that generally run the body down to a point that it's not making its own endogenous cannabinoids effectively anymore. And then we go and supplement it with phytocannabinoids from the plant. But I know that you are an expert also on pet nutrition, and I know we're talking about a lot of different animals today, right? But I think that one of the key things is that if people put the care into the proper nutrition of their animals, that even if something goes wrong, their body's more likely to bring their endocannabinoid system back into balance and thus the other systems back into homeostasis all on its own. So outside of the use of supplementing with cannabinoids, what's a perspective that you would offer to people who care for their animals just so their nutrition is high enough that endocannabinoid deficiency is less likely?
Sure. So just to speak to endocannabinoid deficiency specifically, I mean, that is a very, very difficult, if not impossible, thing to really prove in any given individual. So it's a very difficult thing to quantify. That said, you can't have good health without nutrition. Without appropriate nutrition, no matter what kind of supplements, no matter what form of cannabis a patient may be taking, if they're not eating right, then they're probably not going to be healthy. And that, that's always the first conversation I have with anybody that brings their pet into my office is what ideal nutrition looks like for their pet, because that's got to be the foundation to everything.
And so what is there a general guidance? Like what I'm kind of like poking at is, do you recommend that people, give their animals, like whole foods, that they, go to the extent to make them meals? Right. Is an animal chow sufficient? I don't actually have an opinion on this. I'm just curious, along with probably a lot of the listeners.
Gotcha. So I am very much a proponent of fresh whole food diets. So, the bottom line is that no animal or no person evolved eating highly processed foods. Our bodies are not particularly ideally equipped to eat things out of a can or out of a bag. My preference is always to have my patients eating fresh whole food diets. Now, whether those diets are raw food versus cooked food that they've purchased from a company that makes it, or if they're making food at home using an appropriately balanced recipe. Any of those things are fine. But as is the case with all of us, the fresher and the more whole foods they're eating, the better off they're going to be.
Right on. So, mostly we've been talking about using cannabinoids today as a solution. Something's wrong. But what do you think about using cannabinoids as a preventative? Like your animal already is healthy, and yet we know that THC prevents cancer long term, and we know that supplementing the endocannabinoid system with cannabidiol is generally good for health. What do you think about giving supplementation with cannabinoids, even if the patient is not presenting a problem?
You know what? I mean, I think what we're really talking about here is microdosing. And the truth of the matter is I don't know. I don't know that anybody really knows, in the sense of, as we've discussed, I mean, we have so little research as far as use of cannabis to treat known disease. Using cannabis as a preventative is, I think it's an intriguing question, but I just have nothing to offer by way of, is that a good thing or a bad thing?
Well, fair enough on that. Well, Dr. Gary Richter, thank you so much for sharing some of your valuable time with us. This was a different kind of show for me, because with a lot of these shows, since I talk and teach much of this medicine for humans, I kind of know the answers in advance, but I was surprised time and time again chatting with you. So thank you for sharing your very unique and hard-earned knowledge, and good luck on your pursuits with the laws changing so that you can actually start discussing this with other veterinarians.
Thank you so much. It's been my pleasure to be here.
If you'd like to follow up with Dr. Gary Richter, or if you'd like to bring your pet to his office, I've got two websites to share with you. If you live in the San Francisco, Oakland area, and you actually want to visit his office, you can find out more about the office at holisticvetcare.com. Now, if you want to access Dr. Gary Richter's brain, but you don't necessarily live in California, you can also go to his website, where he provides general pet information on a range of issues, where you can read that and then apply it wherever you live. And that's at drgaryrichter.com. And Richter spelled Richter. So it's drgaryrichter.com. And you can find general information about your pet that is not going to involve you having to go into the office. You can find more episodes of the Shaping Fire podcast and subscribe to the show at shapingfire.com and on Apple iTunes, Stitcher, and Google Play. If you enjoyed the show, we'd really appreciate it if you'd leave a positive review of the podcast wherever you download. Your review will help others find the show so they can enjoy it too. On the Shaping Fire website, you can also subscribe to the weekly newsletter for insights into the latest cannabis news and product reviews. On the Shaping Fire website, you will also find transcripts of today's podcast as well. For information on me and where I will be speaking, you can check out shangolos.com. Does your company want to reach our national audience of cannabis enthusiasts? Email hotspot@shapingfire.com to find out how. Thanks for listening to Shaping Fire. I've been your host, Shango Los.